Have you also been looking at the cost benefit and savings, especially from a public health perspective?
Yes, this is one of the work we have done a few years ago. We took all the patients with the respiratory disease, and these patients are followed up with homeopathic treatment, and we check with the system using objective data, because Tuscany region is monitoring the cost for each citizen with a system. When the people is going in the pharmacy and takes drugs, they use the card of the Tuscany system, and this is monitored. And we monitor the consume of drugs 1 year before and 2 years later after the homeopathic treatment, and we see that we have a reduction of 50%, around 50% of the drug consumed. In some pathology like asthma, it arrives to be 70%. And also, but this is interesting, we took also a control group and monitoring this group similar for the consume of drugs to our groups, and we see that in this group was not a normal reducing after 2 years. Opposite, they increasing 10-30% the expenditure of the drugs for this pathology. So the delta, the difference between our cost, also including the cost of the homeopathic medicine and the normal cost if you don't use homeopathy, is quite big.
What can other countries and public health systems learn from your experience in Italy?
Well, you know, it's difficult to compare because in Europe there are different models of health systems. We in Italy we have federalistic models. So far we had the possibility as a region to have a certain autonomy and to decide with the regional health plan to give impulse to the integration and inclusion of complementary medicine. So this kind of model is exportable or can be a good practice to adapt to all the systems, like for instance here in Spain, in which there is autonomous region, they can decide something. Where the system is very much centralized, of course we have to go to the national level. But what is interesting that from a regulatory problem, we have a law, we had a law, Tuscany law in 2007, and it took 3 years to put in practice, but we have a system of accreditation of medical doctors and also institute that give training and education in complementary medicine, I mean acupuncture, homeopathy and herbal medicine. And this regional law became this year in February a national law. Through an agreement between so-called of the conference, so-called conference between state and regional and autonomous provinces, and it has now to be received by the region with an act, and it becomes law in effect. And this state all the criteria to accept the medical doctors and next time veterinary and pharmacist in the list, a register managed by the chamber of medical doctor and even eventually veterinary and pharmacist, in which so the people, citizen, can recognize who is an expert, recognized expert in homeopathy, acupuncture, etc.
Why is research so important?
Well, research is so important because they give to you the possibility to be inserted in the system. But in the other side, to be inserted in the system give you the possibility to make the research. So it's a balance between the two. You need, as we have written in our health regional plan, to reach a sufficient level of efficacy, demonstration proof of efficacy, evidence-based, and also to give an answer to the demand of citizens. Because in Italy there is about 20%, and in Tuscany maybe more, people asking for complementary medicine. And one of the principles of the region is equal access to the health service in public system. So this must be very important to take in balance between the importance of the research and the importance to give an answer to the demand of the citizens.